Question number 441. A patient with a severe diverticulitis had surgery for placement of colostomy. So the patient upset, crying and will not look at the colostomy site. So which of the following would be the highest priority nursing diagnosis at this time? So option A, knowledge deficit related to colostomy care. Option B, distorted body image. Option C, self-care deficit. And option D, alteration in comfort. So option B, distortion in body image is correct answer. Question number 442. A patient present to emergency department with a complaint of headache, dizziness and confusion. So clinical symptoms include the dyspnea and tachypnea with the use of accessory muscles to facilitate the breathing. So which of the following order would the nurse most likely implement to reduce the patient confusion and orientation? So option A, oxygen therapy. Option B, chest physiotherapy. Option C, bronchodilator. And option D, hydration with fluids. So option A, oxygen therapy is correct answer. Question number 443. A nurse is implementing the nursing intervention to monitor a patient following kidney surgery. So which of the following complication would be the most likely we can see in post-operative period? So option A, deep vein thrombosis. Option B, hemorrhage. Option C, nausea. And option D, hemiparesis. So option B, hemorrhage is correct answer. Question number 444. While caring for a patient prior to surgery to amputate the leg, so what is the most effective measure to prevent the phantom leg sensation after the amputation? So option A, control the pain prior to the surgery. Option B, make sure the patient understands the procedure. Option C, elevate the limb on 2 pillows. And option D, help the patient grieve for the limb. So option D, help the patient to grieve for the limb is correct answer. Question number 445. If a patient develop a complication during the blood transfusion, so the nurse first action should to do first. Option A, stop the infusion. Option B, notify the practitioner. Option C, administer an antihistamine. And option D, administer an anti-inflammatory medication. So definitely option A, stop the transfusion is correct answer. Question number 446. A patient has an elevated prothrombin time. So which medication should the nurse consider as a possible cause of elevated PT time? So option A, rifampicin. Option B, vitamin K. Option C, birth control pills. And option D, phenytoin. So option A, rifampicin is correct answer. Question number 447. A physician ordered the lactated ringal solution to infuse at the 125 cc per hour. And this is an example of which type of solution? So option A, hypotonic. Option B, isotonic. Option C, hypertonic. And option D, hyperelimination. So option B, isotonic is correct answer. Question number 448. A patient is in the pre-operative area to lumbar surgery and the patient report anxiety about the procedure and like about waking up during the surgery procedure. So the nurse must discuss the patient concern with the option A, anesthesia provider. Option B, surgeon. Option C, scrub nurse. And option D, charge nurse. So option B, surgeon is correct answer. Question number 449. A patient has peripheral vascular disease and nursing diagnosis is ineffective perfusion of the peripheral. So which of the following is an appropriate goal? So option A, the patient will identify 3 factors to improve the peripheral circulation. Option B, the patient will have palpable peripheral pulses in 1 week. Option C, the patient feet will feel like warm to touch. And option D, the patient will ambulate the length of the hallway. So option B, the patient will have the palpable peripheral pulses in 1 week is correct answer. Question number 450. The nurse is teaching the parent of the child with the celiac disease. So which of the following diets should be reviewed with the parents? So option A, gluten free. Option B, dairy products. Option C, vegetarian. Option D, sodium restriction. So option A, gluten free is correct answer. Question number 451. During the post-operative period, a nurse is assigned to care for a morbid obese patient with an abdominal incision. So nurse know that this patient weight increases the risk of option A, left-sided heart failure. Option B, pressure sore of the coccyx. And option C, constipation and ileus. So option D, wound dehiscence. So due to this morbid obesity, the patient is risk for wound dehiscence. So option D is correct answer. Question number 452. A home care nurse visited a diabetic patient who was started on insulin injection. So upon examination, the nurse observed the small lumps and dent on the right upper arm, so where the patient has injected insulin. So which is the best nursing intervention here? So option A, refer the patient to dermatologist for diabetic cellulitis. Option B, instruct the patient to rotate the site of injection. Option C, refer the patient to the and for the better control of glucose level. And option D, instruct the patient to inject in the muscular area instead of the other area. So option B, instruct the patient to rotate the site of the injection is correct answer to minimize such type of lumps and dent. Question number 453. A home health nurse visit a patient with the COPD. So using the home oxygen at 2 liters per minute, the patient reported period of the shortness of breath and inquired about the increasing the oxygen to 4 liters per minute. So the nurse explained that increasing the supplement of oxygen will. So option A, increase activity tolerance. Option B, suppress the hypoxic drive. Option C, alleviate the shortness of breath. And option D, prevent the lung infection. So option B, suppress the hypoxic drive is correct answer. Question number 454. The nurse should avoid the use of dorsogluteal site for an intramuscular injection in children because of the risk of injury to which of the following nerve? So option A, vagus. Option B, sciatic. Option C, iliac. And option D, lumbar plexus. So option B, sciatic nerve is correct answer. Question number 455. A patient with a spinal cord injury state, I have no control over my situation and I can't do anything for myself. So this patient is exhibiting option A, powerlessness, option B, delusion, option C, suicidal ideation, and option D, resignation. So option A, powerlessness is correct answer. Question number 456. A nurse is caring for a post-operative patient who is on subcutaneous low-dose heparin. So this medication is used to prevent. So option A, deep vein thrombosis. Option B, congestive heart failure. Option C, paralytic ileus, and option D, pneumonia. So option A, deep vein thrombosis is correct answer because low-dose heparin usually will give to prevent the such type of incidences. Question number 457. A patient is recently diagnosed with herpes zoster. So nurse establishing the care plan, so would most likely assign the highest priority to which of the following nursing diagnosis? So option A, anxiety. Option B, social isolation. Option C, peripheral neurovascular dysfunction. And option D, acute pain. So option D, acute pain is correct answer because herpes zoster usually cause the severe nerve pain. Question number 458. A patient with measles is on the airborne precautions. So which of the following precaution technique would be essential to implement for the non-immune person entering the room? So option A, gloves. Option B, gown. Option C, face shield, and option D, mask. So option D, mask is correct answer. Question number 459. A 2-year-old child in the emergency department exhibit the symptoms of bacterial meningitis. So which of the following tests confirm to rule out this diagnosis? So option A, magnetic resonance imaging. Option B, magnetoencephalogram. And option C, computerized tomography. And option D, lumbar puncture. So option D, lumbar puncture is correct answer. Question number 460. A patient exhibit the clinical manifestation of pulmonary embolism and arterial blood gas level and the chest x-ray are ordered. So which of the following test is used to diagnose this condition? So option A is computerized tomography scan. Option B, magnetic resonance imaging. Option C, pulmonary angiography, and option D, pulmonary function test. So to rule out the pulmonary embolism, definitely we need to perform the pulmonary angiography. So option C is correct answer. Thank you.